Hello, everyone. It is a pleasure to be here today in Vancouver and an honor to contribute to the discussion around building digital societies as a representative from Estonia. As the past 2 years have made painfully clear, strengthening and improving our healthcare systems within our societies is absolutely critical to withstand the punches of modern global challenges, and of course to sustain the health and well-being of individuals and society as a whole. And in the same regard, the past 2 years have also brought digitalization to the forefront as a strategy for strengthening our healthcare systems and making them more resilient and efficient. Now, any system is only as strong as its foundations, and to embark on a sustainable path of digital transformation and to eventually accelerate this process, we need to get these foundations right. And this is also the focus of my talk today. So as you heard from the introduction, I'm from a research and development focused Estonian IT company called Cybernetica. And what brings me here today is actually Cybernetica's close involvement in digitalizing the Estonian state and society. Since the early 2000s, we have been a strategic partner for the Estonian government in creating a number of the technologies that power the Estonia's digital state today. And over the past 20 years, Cybernetica has then been taking the technologies and the experience that we gained in Estonia and supporting other countries in achieving the same. So my talk today will therefore be drawing on this experience, highlighting the foundations for digital healthcare and what these foundations could and should enable if they're done right. There we go. So before I get to this, I would like to start by asking, what comes to mind when I say the future of health? Some of the common responses and some things that we've already heard today as well are personalized medicine, increased prevention, early diagnosis, delayed onset of disease, more precise and less intrusive treatments focused around the patient, and patients who are in control of their health and their well-being. Of course, by now we all understand that digital technologies are an inseparable component of reaching this vision for the future of health. And the premise of our event today also acknowledges that it, of course, starts with the smallest yet most significant component of all, the data itself. In the decision-making processes and value chains that run through our healthcare systems, data is really the fuel that carries the information that we need to leverage in order to move towards this future that we are envisioning, a future with better healthcare by making better use of data and technology. So how do we leverage this data? This data that often exists in silos, in different formats across organizations. How do we get from this data to the impact that we are trying to have? Usually this data is stored and located within various information systems and databases, and these are governed by specific organizations, healthcare providers, government agencies, universities, pharmacies, you name it. Now, digital services that rely on data from different organizations can be created when this data becomes accessible, something that we've already heard about today as well. And more importantly, this data in such systems has to be accessible in a standardized, secure, and convenient manner. And it is through these digital services that run smoothly and seamlessly that we then arrive at this impact that we are trying to have, better healthcare by making better use of data and technology. And in Estonia, we learned that this line of impact relies on two foundational building blocks: data exchange and the interoperability of systems, which enables the creation of digital services in the first place, and digital identity, which ensures secure and convenient access to these services. Now, for the purpose of our event today, I would like to focus on the former, so the data exchange layer. But if you're interested in the digital identity component, then you can find me later, and I'm happy to dive into this as well. But for now, through this illustration, albeit simplified, we can see that by building a strong data exchange, data transfer layer, we're laying the groundwork for generating this impact that we are trying to have with these developments. Now, to connect this with a practical example, we can turn to the case of Estonia. The decentralized data exchange system in Estonia is called the X-Road, and it was already introduced and implemented in the early 2000s. Cybernetica played a role with this development as well. And by today, Estonian citizens are able to access 99% of government services online. And in hindsight, we see that this would not have been possible without the X-Road. And this is because behind the curtain of Estonia's digital state, the X-Road enables organizations to exchange data through secure and encrypted channels, and the ability to exchange this data securely and in a standardized way is the key that has enabled the creation of digital services. Today, there are over 680 institutions that are connected to the data exchange platform, with more than 3,100 services provided through this data exchange, and these numbers are growing by the year. And as X-Road underlies all data exchange in Estonia, it also underlies the health solutions and services that are provided in the Estonian systems, and the services that specifically then rely on the data from different organizations. So you may now be wondering, what are these solutions that have been created over the past 20 years? In other words, what has this data exchange layer really enabled? And here I'm happy to bring a number of examples. So first, the electronic health record. This is a nationwide system that integrates data from different healthcare providers, and in so doing, the system creates a common record for patients and doctors to access online. This and all other health-related services are available through one secure portal, that is the digital patient portal. And the e-health record is a powerful tool for doctors that enables access to patients' records through one single source of truth, without having to ask the patient to retrieve this information or provide this information multiple times. And at the same time, it is a very convenient solution for patients who can rest assured that all their data is retrievable and stored safely and conveniently in one secure portal, while still having full control over how this data is accessed and used. Now, importantly, every point of access to certain data, either by the patient or the doctor, is logged within the system. And this is available for the patient to monitor and control also in the patient portal. In Estonia, by law, citizens are the owners of their data, and in the portal, this manifests as the options for patients to not only track access to data, but as Ats from Nordsel mentioned earlier, also the option to open and close access to certain records, making sure that the info they wish to keep private will remain private in a selective way. The data exchange system has also enabled the digitalization of medical prescriptions. In Estonia, prescriptions are issued by doctors and connected to citizens' ID cards, which can then be used in a pharmacy to purchase prescriptions by the patient. And what's more, not only can these prescriptions be purchased in Estonia, but as of today, Estonian citizens can also access their prescription medicine in Finland and Croatia, which is a perfect illustration of how the impact of this digitalization can be extended beyond borders if the foundations are laid somewhere else as well. Another interesting solution is the e-ambulance service. This enables a rapid response during an emergency call, specifically with a patient's personal identification code. The ambulance can query the health information system for the patient's medical records, and the system will automatically fill out a form and provide relevant data to the ambulance car, whether they are on their way to the scene or already on their way to the hospital. And knowing the patient's allergies, blood type, and any conditions that they may have allows the emergency response team to make an accurate and timely decision in their response. And finally, I also wanted to highlight the role of data exchange in the Estonian Genome Project, which I know some of you have already heard of. The Estonian Genome Project is a national biobank which has been collecting data since the early 2000s, with more than 20% of the Estonian adult population becoming donors during this time. And in addition to genetic data, other health data of the donors has also been collected. to expand the value and the scope of research that is being conducted. And today the project is on the brink of being a significant launching pad towards personalized medicine in Estonia. And when this happens, the patient portal will also be used to make the findings available to the donors. At the moment, the data exchange system, X-Road, has enabled the secure and privacy-preserving exchange and collection of personal health data. And in the future, X-Road will continue to be the highway on which all this information will be traveling to the patients. So to sum it up, with this sort of invisible data exchange foundation laid already in the early 2000s, Estonia is now in a position to be connecting more organizations into the network and providing additional digital services on top of this when the needs arise. And the impact of this is felt by all the stakeholders involved, who do not need to waste valuable resources gathering and transferring data manually between various institutions or duplicating data in this process. Rather, the data exchange technology seamlessly takes care of that. So now the question is, how could Canada achieve something similar? Well, there are many ways that this could be answered, but in the last 3 minutes that I have left of this talk, I'd focus on the most matter-of-fact ones, some of which you've already heard in the panels previously as well. So these are my standard 3 keys to success, drawing on cybernetics experience in implementing data exchange across sectors, as well as Estonia's experience in building its digital state and society. And the first is mindset. So digitalization is not a one-time project with a clear end date or time. It is a fundamental shift in mindset, an acceptance of a long-term path of transformation and a different way of doing things. The best time for making this mindset shift will probably always be sometime in the past, but the next best time is definitely now. Digitalization is not about the replication of analog processes in the digital space. It is a fundamental transformation of how things get done, how processes are led, managed, and sustained. With the acceptance of a long-term commitment, the good news is that we are not looking to build digital Rome in a day. And so the second key to success is embarking on a phased approach. Now, if we remember that stairway from the beginning of the presentation where we went from data to impact, a phased approach means walking that stairway with a select group of stakeholders first, in a selected domain, building capacity there, delivering digital services in a selected space first, generating impact through that, and then building the network further from there. This supports inspiring other stakeholders through practical results, through showcasing practical results, incorporating lessons learned along the way, and introduces a degree of agility that is required for thriving in a digital world. But of course, these phases need to be managed and orchestrated well, which brings me to the third element, and that is, of course, leadership and political will. So, coming back to the example of Estonia, when sharing Estonia's achievements in the digital sphere and proposing some ideas for how this could be achieved elsewhere, then the first excuse, as I would call it, is that comes up specifically in international audiences, is that you are a country of 1.3 million people. Of course, you managed. Now, I can let you in on a little secret. Size and population size has nothing to do with this success. Countries of varying sizes have succeeded in digitalizing their systems, and they have done it fast. And in some cases, you can't even digitally transform an organization of 50 people. Estonia didn't manage because there's only 1.3 million of us. We managed because Estonia's leadership made the right decisions at the right time, at the right place, welcomed a broad and open public-private partnership, and were serious about the changes that they wanted to make and recognized the importance of the opportunity in front of them. Whether we are starting from zero or transforming legacy systems, it all comes down to leadership. A vision for what we are trying to achieve and why, a strategy for how to get there, Good leadership does not look for excuses or problems, but looks for solutions. Best practice is ready to collaborate and accept responsibility for both being agents of the positive transformation that they want to see and accepting that this is an imperfect journey that will require to learn on the go. But as long as the end goal and the impact that we are trying to generate better healthcare by making better use of data and technology, as long as that end goal is clear, shooting for the digital moon will definitely help you land among some digital stars. And as I see, my time is up as well. So with that, I would like to wrap up my presentation and give the floor to the panel as well. And from my side, thank you also to CityAge and all the partners for the opportunity to be a part of this event. It is an absolute pleasure and honor to be here. And if any of you would like to continue the conversation around any of these topics that I talked about today, then approach me and I'm happy to answer any questions that you may have. Thank you so much.